Thunder Bay Regional Health Sciences Centre plays a key role in healthcare for the people of Northwestern Ontario. As the only academic health sciences centre in the region dedicated to providing complex, acute, and specialty care, we teach the next generation of healthcare providers and, through the Thunder Bay Regional Health Research Institute, advance medical research. With the launch of Strategic Plan 2026, jointly with the Health Research Institute, we outlined our priorities of equity, diversity, and inclusion, patient experience, staff experience, research, innovation, and learning. These directions, along with supports, will lead us to a stronger, healthier, and sustainable future. Research has shown that patient outcomes are directly related to the quality of the work environment. Because of our remarkable staff, our hospital is a leader in patient and family-centered care. But, like all hospitals in Ontario, we must compete for healthcare workers and plan for future human resource needs. To improve staff experience, we are taking action to foster a work environment that is safe, where staff feel supported and valued, and where staff have the opportunity to learn, grow, and thrive.
Since I started at the hospital 3 years ago, a lot of my work has been around chronic disease prevention, and staff wellness is a big part of that. Having a positive staff experience is super important. Having buy-in from not only the staff, but senior leadership will help us to implement positive changes. The Staff Advisory Committee was started earlier this year, and it's made up of a diverse group of representatives from across our hospital, various departments, and we are all very dedicated to improving the staff experience. We want individuals to recognize the excellence of our hospital and come to work here, but it's also important that each day our staff come to work, they feel safe and excited to be here.
In early 2021, we were in crisis mode. We were at the height of a pandemic and our department was under strict operations. Staff burnout became prevalent, resulting in worsening shortages and overall low morale. Mental health and substance use presentations skyrocketed and violent outbursts became frequent. Unfortunately, we also had a few very close calls involving weapons that were a hair's breadth from ending in tragedy. Staff did not feel safe working in our department. This message was thankfully received loud and clear by the hospital senior leadership, who committed their comprehensive resources to address workplace violence in the ER. The recommendations that came out of this were improved public communication, improved access to psychiatry after hours, better training for security personnel, a dedicated addictions worker, a policy for search and seizure of personal belongings, and a dedicated de-escalation patient care area. People come to the emergency room to be cared for in their darkest hours. They expect it to be a safe place for them. That's precisely what we want it to be for both our patients and our staff.
We were really in a position where we needed to extend the manpower of what we had. While we work really hard to recruit additional anesthetists, and we have had 2 new anesthetists come and join us, we've also been very successful to get physician extenders in place that can also provide a little bit of relief and respite for our current anesthetists. Patients will do better if they have less pain. In many cases, it actually means that they don't need to stay overnight in hospital. If their pain is well controlled, they can go home. I think in terms of improving morale, the addition of anesthesiologists and nurse practitioners really means that we've done something important and concrete to take the pressure off of our anesthesia team. It wasn't just a well wish or a good thought or a you're doing great. We've actually practically taken off some of the responsibility, and that's an important step right now.
It's sometimes very difficult. You can think and do, but you can only think and do so many things at one time. You need to delegate to somebody, and we can now provide clinical care either in the operating room, so we can go up a room a day, or we can provide sedation and anesthetic care in other areas of the hospital that are necessary. The anesthesia assistants are different because they are the only other person apart from an anesthetist who can monitor a patient under general anesthesia. They're dedicated just to us, so we no longer have to kind of try to manage, think, and do all the things ourselves because, say, the nurses are occupied. We actually have someone dedicated to us who knows our profession and knows what we need and can help us provide that care in a timely fashion. This has really been the biggest development in our department in many, many years.
Thunder Bay is a small town, so everything is very close together. So here we have a research institute within an hospital. There's also the medical school and Lakehead University around. And ultimately, these days, you need to have interdisciplinary research to be effective, to be functional. People cannot do their own research in an isolated lab now. So having everything very close together gives the opportunity of people to work together, and use the skills that everyone has to try to make better projects, make projects that are more efficient. And ultimately, the goal for most of us is to develop better treatment. I was interested to come here because it was giving me the opportunity to work in translational research and develop skills that will be useful for the rest of my career.
Our hospital is more than just a place to receive care, and our Health Research Institute is more than a place to advance science. Making a difference in the lives of our patients and families is something we hear about each and every day. We also know that patient experience and staff experience are directly connected. So by prioritizing our staff, developing our culture, and engaging our people, we are creating an environment that supports the best care, while creating a place that supports our people to grow, be challenged, inspired, and ultimately thrive. It is what will help us to achieve our vision of exceptional care for every patient, every time. And at the end of the day, it's why we do what we do.